Hello and welcome to Med Madness, your go-to podcast for medical knowledge and insights. Today, we will delve into a crucial topic for all medical students and professionals, acute heart failure. Understanding this condition is vital because it not only helps in diagnosing and managing patients efficiently, but also plays a significant role in improving patient outcomes. In today's episode, we will cover what acute heart failure is, its causes and pathophysiology, symptoms and clinical presentation, diagnosis, management and treatment options. We will also present a real-world case study to illustrate these concepts in action. Acute heart failure is a sudden onset or worsening of the symptoms of heart failure, a condition where the heart is unable to pump enough blood to meet the body's needs. Common causes and risk factors include coronary artery disease, hypertension, cardiomyopathy, and valvular heart disease. The pathophysiology involves reduced cardiac output, leading to decreased renal perfusion and activation of maladaptive neurohormonal mechanisms like the renin-angiotensin-aldosterone system and sympathetic nervous system. This creates a vicious cycle of decompensation due to detrimental interactions between the heart and kidneys. Next, let's discuss the symptoms and clinical presentation. Patients with acute heart failure often present with dyspnea, orthopnea, paroxysmal nocturnal dyspnea, jugular venous distension, lung crackles, and lower extremity edema. Hypertension, cool extremities, and diminished pulses are also common. Elevated brain natriuretic peptide levels and a third heart sound may be present, indicating increased ventricular filling pressures. Moving on to the diagnosis. Diagnosing acute heart failure involves a combination of clinical assessment and diagnostic tests. Key tests include measuring serum BNP levels, chest X-ray, echocardiography, and ECG. Elevated BNP levels are highly sensitive for heart failure, while a low BNP level can effectively rule out heart failure. Imaging techniques such as echocardiography help evaluate cardiac function and identify underlying causes like myocardial ischemia or valvular dysfunction. Now, let's cover the management and treatment. The management of acute heart failure focuses on stabilizing the patient and addressing the underlying causes. Initial steps include evaluating clinical stability and providing respiratory support if needed. Intravenous diuretics like furosemide are used to reduce preload, while vasodilators like nitroglycerin or nitroprusside may be administered to decrease afterload. Inotropic agents like dobutamine are used in cases of severe left ventricular systolic dysfunction and cardiogenic shock. Lifestyle modifications and preventive measures, such as fluid restriction and monitoring for potential triggers, are also crucial in managing this condition. Complications of acute heart failure can include renal dysfunction, arrhythmias, thromboembolism, and multi-organ failure. Early recognition and management of these complications are essential to improving patient outcomes. To summarize, acute heart failure is a critical condition that requires prompt diagnosis and management. Understanding its pathophysiology, clinical presentation, and treatment options is essential for medical professionals. Early diagnosis and intervention can significantly improve patient outcomes. Don't forget to engage with our pre- and post-podcast quizzes to test your understanding of today's topic. Thank you for listening to Med Madness. Stay tuned for more insightful episodes and remember to subscribe to our channel for the latest updates.